CVS Caremark has 200,000 workers and wants all of them who use the company's insurance to fess up these figures by May 1st. I've heard of incentivizing good behavior, but humiliating and now charging for bad? Sick, really sick. But again, that's just me. And I'm thin. Kinda. Well, I know it's got to be bad because even a very fit Hadley Heath, and by the way, not Hadley Heath Bar, is seeing red. Says this is very stupid. Also here to chew the fat. Reason magazine's always reason. Matt Welch, he gets sick of hearing that, but I just love saying it. And we got business owner Rob Basso with us as well. So Hadley, what do you make of this?
Well, I like Heath bars, but I don't like this policy. And there's really two forces driving this. First of all, health insurance premiums, the cost trend is going up, and there's no sign of that slowing or changing direction anytime soon. Employers consistently point to health costs as one of their top concerns. Another side of this is Obamacare. Quite frankly, you know, we've heard so much about how we don't want our bosses in our personal business. We don't want our bosses in our health care information. But when our bosses are one of the many payers in a chain of this payment system, then they become very interested in how much we're going to cost them in terms of health insurance and health costs.
I think you raise a good point, Matt. It is perfectly understandable in this environment to watch your costs and to watch, I guess, the risks to those health costs.
Why do we have our health insurance dictated by where we work? What is that? I mean, that's because of wage and price controls in World War II era, and we've just kind of, where we had them, and so
I understand, but it is what it is.
It is what it is,
right.
But that's what you get. Obamacare could have departed from that. It could have said, let's go towards a system where we get to own our own health care, where the person snooping on us is us, and our insurance companies making a deal with one another, and that could be portable when we went to a new job. Obamacare said, no, we're going to double down on the existing system and cement that tie between employer and employee.
But maybe, or usurp it with a government single-payer system that takes it out of the equation.
Well, yeah, and then the government is the one snooping in on you. Ultimately, you don't own your own information, and so this is an inevitable, creepy result of really bad public policy.
And he says that, and he's very thin and fit. All these guest stars, which is kind of bugging me, because I had specifically asked book an obese person, but I'll get to the producers after the show. Rob, what do you make of it?
You're going to see more and more of this, especially from large and medium-sized organizations. You look at CVS with 200,000 employees. They're just mimicking what the federal government is modeling. They're saying be invasive, you know, control the health care costs.
I can't really blame them. I don't like the intrusion, but I understand what they're up against.
They're up against increased health care costs. And think about it. They're a public entity. Their job is to add shareholder value and shareholder equity. So if they get to lower their expenses by having more healthy employees, that's what they're going to do. It doesn't make it any better, because the flip side is they're going to be infringing on people's personal rights. Sharing information with a third party, aren't there HIPAA rules against some of this?
And by the way, the notion that, because CVS has said that they're not doing this, but I just want to quote them verbatim. This is from CVS. We want to help our employees to be as healthy as they can be, which is why we decided to implement this plan. And healthy as can be would be, if you're fat, don't be here. And Hadley, I could be wrong, but I'm reading into that certainly if you're not going to hop on the scale or provide any of this stuff, they've assumed you're unhealthy anyway, right?
Right. You know, MIT health economist Jonathan Gruber looked at this policy, felt uneasy about it, said there's a thin line between discriminating against sick workers and then having what might be called a wellness program. CVS might be looking into getting their benefits provider to suggest a wellness program. But as Matt mentioned, the best wellness program is giving individuals the opportunity to oversee their own health care, their own healthcare decisions. And that is the only kind of empowerment that can come through direct transactions from patients and doctors without all these many payers in the system clogging up the paperwork and the pipeline of money in between.
Neil, here, Duke University recently did a study, and they showed that obese individuals cost up to $51,000 or $52,000 in workers' comp claims compared to a healthy individual, which was only $7,000 or $8,000. So CVS is just looking at this and saying it's pure numbers, plain and simple. They're not looking at the humanistic side of this, which is what we're discussing right now. They care about the numbers.
I understand, but Matt, I also think there's a threat here, and it could just veer this direction, where we create this master working race, right? It's of thin, fit people, not people who are limping or fat and limping, because they just look risky.
You can agree not to, or you can have a policy to not hire smokers in more than 20 states in this country legally. Fire departments, routinely, hospitals say, we will drug test you. We will look in your urine to see whether you're lying to us about being a smoker. And if you're lying, they can fire you with cause, and there's nothing you can do about it.
But in some of those places, well, I'm not a fan of this. In some of those places, like in a hospital, I can almost see it, right? But let's say the cashier at CVS.
No, I mean, I took
I
had to take a drug test at the Los Angeles Times, right?
Did you pass it?
As far as I know, they didn't give me a grade.
I really wanted.
I thought I'd get a B+ this time. But when I worked for the University of California, I had to sign a loyalty oath to defend the Constitution of the state of California in order to work there. So yeah, it's not voluntary, but it's a job, and we can discriminate legally in this country.
No, you're right. But it can also lead to snitching, right?
Part of our,
like you're a thin guy. But I'm all of a sudden, I'm going to go to my boss and say, he goes to Wendy's every day. He's on his way to becoming a fat guy.
Well,
we might cut him off now before he becomes Jackie Gleason.
Part of our challenge is, as Americans, we want our Big Macs, but then we want our health care to take care of us when we have diabetes. It's like we can't have it all the way all the time.
So you're for this, understand this, sign on to this, sign on to the end of freedom as we know it.
No, I understand why corporations decide to do it. I think there has to be a healthy balance, and I think using an incentive rather than a penalty is the way to go. That's what I do at my company.
But if you ignore the incentive, if your workers ignore those incentives, what do you do?
I have in my business.
Give them a box of candy and explodes.
No, there is not a penalty for not complying. It's if you comply. We have wellness programs.
But you're looking at them all the time, right?
No, it's not really the way that it happens. I think most small and medium-sized employers don't look at their staffs that way.
Okay, Hadley, I hope he's right. I hope he's right. But the cynic in me says it leads to that type of thing.
Listen, people are individuals. Every person has their own body. They have their own healthcare needs. They have, their preferences, how often they want to see a doctor or not see a doctor. All of those things impact our healthcare costs. So looking at studies about groups of people or looking at how overweight you might think this or that worker is, that's putting people into groups and classes. And the bottom line when it comes to healthcare is there is no one-size-fits-all. And that's the mistake of Obamacare. That's the mistake of any federal top-down healthcare program. That's why we need to empower individuals to interact directly with their doctors as patients.
All right, I want to thank you all. In the meantime, I'm going to try to get my hands on Matt's reports that he submitted over at the LA Times and tests and all, because I'm just not buying. I'm kidding.